And IPF, idiopathic pulmonary fibrosis, it's one of the most common ones among the ILDs. It's a rare condition, and that's really why why we get into the point of like having to increase awareness about it, because it's still, although there's about 40,000 patients that are diagnosed with IPF every year, compared to some of the other conditions like diabetes and hypertension, it is comparatively rare. But in spite of that, though, the progression of the disease is so much faster, especially without treatment. We know that without treatment, while it's variable, like not every patient behaves in the same manner, but the lung function decline is there, and the approval of two of the drugs, which is nintedanib and pirfenidone, really made a difference to how we were treating patients with IPF. Introduction of these approval of these medications definitely have improved outcomes among our patients, but there's no therapy that can really, like, these medications slow down the disease progression, but they don't really completely halt it, nor do they reverse the scarring that's already happened. So that's where really, it's of prime importance why we need to diagnose early, so that we can start treatment early and try to slow down that disease progression even more. Some of the studies, which not just the clinical trial that were done, but even real world data that we've looked at, really has shown that it doesn't matter where your lung function is when you start off, whether it's like at 90% or whether it's at 60%, there is still benefit from these medications. And the earlier we can start it, the more benefit we're going to get from that. Now, that's really IPF. Now, when we talk about other conditions, like those that are associated with autoimmune conditions, like rheumatoid arthritis or scleroderma or Sjogren's, in most of these conditions, there's a lot of inflammation early on. And then that inflammation eventually goes on to become scar tissue in the lung. If you're able to catch that early, if you're able to diagnose early, we're still in that inflammation phase and we can do medications which suppress that overactive immune system, we might be able to halt some of that inflammation from getting scar tissue or becoming scar tissue. Because once it becomes scar tissue, we're in that, endless cycle of like getting, the scar tissue can make the inflammation worse and more scar tissue is formed. And again, we don't have any medications right now that can really reverse that scar tissue. And really, this is why, we definitely need to work on getting an early diagnosis and starting treatment early.